The first research I have on my list is advocating for inclusive education in the northwest region of Cameroon, realizing behavioral change in a resource-scarce environment. And the key learnings for the CBC Health Services from this research is that persuasion strategies alone in a resource-scarce environment are insufficient to cause behavior change. And now, this is to say that in a resource-scarce environment like Cameroon, during our advocacy outings, we have met with power holders who are willing to take on the advocacy messages and to implement them, but often are faced with resource limitations because either there were no budget provisions around that area or enough resources have not been devolved from the central level to the local level where the implementation has to happen. And so in order to facilitate the agenda, the advocacy agenda, the CBC Health Services in its advocacy strategy has done strategic provision of resources to accompany its advocacy. And as a result of that, the research found out that this strategy is very helpful in a resource-scarce setting like Cameroon. The second research on my list is effective advocacy for children with disabilities, why the political system matters. This research is conducted by Mohammed and published by Mohammed and Albers. And the key findings for us from this research is that a good knowledge of the political system is key in determining the advocacy strategies to use. Now, in Cameroon, in the context of Cameroon, the use of force as an advocacy strategy is not welcome. That can never accomplish much when, movements are organized, there are our power struggles, the use of force to make the government to see the need for change. In Cameroon, those strategies, they don't work. And so for the CBC Health Services, as a civil society organization, we have had rather to use the existing policies. And another key thing also is that for sustainability, local level advocacy needs to go along with national level advocacy. And so in the past, the CBC Health Services has focused its advocacy mainly at the local level. And so since at the local level, there is not much resources, it means that we always need to accompany the power holders with resources to be able to implement the changes that are being proposed in the advocacy message. And so one of the key recommendations from the research was that the CBC should be able to also do advocacy at the national level if we need to sustain the successes that we have been able to record in advocacy over the years. And so I will go on to the next subtopic of my presentation, which is what has been done with the findings of our researches. And the first key thing is that we've been able to produce them in simplified and accessible formats. The photos on the right, they are showing some of the ways that we have been able to produce the research findings in ways that don't look so scientific, because many people, once they see, there's so much scientific presentations and writings with all the references and quotations. I mean, people are scared to read it because it's like too much a big book. So what we have had to do so that it is accessible, I mean, even for persons with disabilities across the impairment types, is to do it in simple to understand format, such that people can even have interactions with as they read. And then also in the projects, also learning events are also embedded such that the stakeholders that participate or that are respondents during the research process also participate in the learning events after the research, which they actually are able to get the key findings and also further make contributions before the final results are published. And also the research findings are widely disseminated through our traditional and also social media platforms, as well as published in our newsletters. And so going to the next subtopic, we're looking at, in fact, what really has concretely, what has been the added value to the CBCHS. I mean, we have had, we've had the lessons that we have learned, but what added value has this really given to the CBC health services? And so the first key point is that it has strengthened CBCHS's self-awareness on successful advocacy strategies, which has actually led us to have the following groundbreaking results. And among is signing of a memoranda of understanding. The CBCHS has signed a memorandum of understanding between the CBCHS and the Ministry of Social Affairs. This is something that we have not done since all through the 68 years of experience in disability provision. CBCHS has never had a memorandum of understanding with the key ministry that is in charge of persons with disabilities in Cameroon. And like you saw, it is because mainly our advocacy has been focused at the regional and local level and without much at the national level. And so with these findings and with our work being now shifted to the central level, we've had the opportunity to sign a memorandum of understanding with MINAS, and then as well as also the Ministry of Health. We've also signed MOUs with local development structures like councils to mainstream disabilities in all council processes. Now in Cameroon, there is much talk about the issue of decentralization, and the government is gradually devolving resources at the local level at this decentralized structures to be able to undertake development activities. And so through our research, it has enabled us to continue signing partnership with these local development actors. It has equally increased the CBCHS's visibility and credibility. Yes, CBCHS was seen as a credible organization because it is a faith-based organization, but these researches again have further increased that visibility and that the credibility. So CBC is now well known even nationally and among the general public as a key disability service provider. I was in the office the other day to receive mails from the mail runner from the Ministry of Social Affairs, and he was like, wow, now the ministry places the CBC health services at the same level like Plan International, like Site Savers, like CBM, and those other key disability partners, which is something that was never the case before. CBCHS was doing a lot, but mostly it was at the local level. And now it has decreased anecdotal evidence in decision making in favor of scientific evidence. Most of the time, usually we will base our decisions, our planning on the information we get from the field, but which is not actually researched and proven. But now with these researches, we can be able with confidence to say we are making decisions that are evidence-based, that are science-based, which is a big plus for our organization in Cameroon. Now, it has also contributed to policy decisions within the organization about relocating the office to Yaoundé, closer to central power corridors. And this relocation of the office is one of the key contributions to the successes we have registered at the national level. And this is because in the findings, it was seen clearly that for our advocacy to be sustained, it needs not only focus at local level, at regional levels, but we also need to go beyond and also advocate at the national level. And so with that, I've come to the end of my presentation, and my conclusion is that it is very important for the academic science world to have a bridge to the practical implementation of civil society organization, of non-governmental organization, so that findings that come from research can easily be translated to policies and to practices of local organizations. Thank you so much for listening.